Welcome back, viewers. Thank you so much for tuning in. My name is Patrick Tawea Matope, and on this channel, I do deliver content on social work, more especially to do with, practicing with children and families, really. In today's video, I'm just going to talk to you about how we can create an inclusive environment for neurodivergent social workers in children and families work, in the work that we do. The way I'm going to be tackling this topic will be I will look at the different types of neurodivergence which are there, and this is based, from my own, practice over the past 20 years, and also my experience of managing teams. So I will talk about the different types of neurodivergence which are out there, which I know of, and I'll also talk about the strength that neurodivergent, social workers will bring to the teams. And I'll also talk about the different aspects of work, how it can be challenging in terms of managing or supporting a colleague with neurodivergent. And also I will talk about how their individual needs, can be met, and how as supervisors you can progress conversations or what things that you can do to make sure that you actually fully support them. So I will put a disclaimer before I proceed. I don't consider myself to be a guru in social work, but I do deliver content based from my own knowledge and from my own experiences of being in the profession for so long, really. So creating, an inclusive work environment for neurodivergent social workers is not only to do with us being legally compliant as employers or as supervisors within local authorities that we work for, or within any other agencies that we're working for, but it's about also harnessing the abilities or the capabilities of such individuals in making sure that we do progress the work that we need to be doing. It's quite essential in ensuring that there is equity, there is productivity in the workplace, and also making sure that we've got a supportive team culture going forward. Really, that's number one, and that's something which is really important for us to be mindful of. What do I mean by neurodivergent, social workers? I'm talking about, when I'm talking about colleagues or individuals where they've got, the natural variations in how their brains do work or function. Why is it important? It's important because to an extent it can also affect the way they respond or the way they progress their work. It can also, have an impact on the way they communicate, the way they learn. As you know, part of the work that we do is about also learning on the job. It can also affect the way they give attention to detail. It can also affect their moods. It can also affect, sensory processing. So that's the main reason why it's important for us to be, cognizant of, other colleagues who are neurodivergent amongst us as well. So the different types of neurodivergence that I know of, or which I can, or which I can actually talk about, having had experience of, working with in terms of the colleagues that I've worked with in the past. I'm talking about being on the autism spectrum, being autistic, for example. So talking about, autism spectrum condition, somebody can be classified to be highly autistic, or so we're talking of a spectrum basically, which it depends with at which position on the spectrum the individual is, and that would be dependent on whether that person has got any sort of like assessment which has been done on them, which will also guide you as a supervisor or as a manager in terms of how you can support that individual. But the other thing we need to be mindful of is sometimes people can be on the spectrum but undiagnosed. So you need to be mindful about those things as well as you are engaging with colleagues. Sometimes if it's not diagnosed, sometimes it's not even their problem, or sometimes they may not even realize that they may be on the spectrum, or sometimes you may see the traits where you are not a professional to be diagnosing, but you may see the traits, and you need to be adjusting the way you work with that particular individual, being mindful of those things. If there are traits that you've seen for a considerable period of time, and you need to be mindful about those so that you can actually adjust the way you work with them at the end of the day. Secondly, we are talking about attention deficit hyperactive disorder. That's your normal, ADHD. We are also talking about dyslexia. We are also talking about dyspraxia. That is, a developmental coordination disorder, which, some individuals can also have. We are also talking about dyscalculia, where individuals may have, considerable, difficulties in making simple calculations that you and I can actually make. There's also what we call Tourette syndrome. There's also sensory processing differences which could be there. There's also any other mental health related, neurodivergence, for example, bipolar disorder, OCD, depending on the context, and also self-identification. Sometimes some people actually self-identify, and you need to be mindful about that. And if somebody self-identifies, then it's something that you need to be mindful to make sure that even in your supervisions, you take note of those things. When you are having conversations with them, you take note of those things, but also being mindful about the need to be keeping their disclosure appropriately with you, and it's something that they may not necessarily need to be shared with the rest of the team and or with the rest of the colleagues, something like that. So you need to be mindful about that as well. I think the bottom line with regards to all these conditions is to be mindful that each person is unique in their own way, and it's important to be harnessing that uniqueness and actually bring it out, to make sure that you actually bring it out in the work that they do, in the work, in the way they engage families, and also overall in the output of the work that they actually produce, including the quality of the work. And your role as a manager would be to make sure that they are fully supported in doing their work, and you are fully cognizant of the difficulties that they may be facing because of being neurodivergent. It's also vital to approach these needs and these preferences individually, because what may occur with individual A may not necessarily be what's going to happen with individual B, even though they are all having, even both of them, they may be having diagnosis of autism, because as you can recall, it's a spectrum, so they might be different. They might be at different places on the spectrum altogether, so to speak. So it's important for you to be mindful about that, in making sure that you individualize them, being mindful of the fact that, they are unique individuals on their own as well. So the strength of neurodivergent colleagues or neurodivergent social workers, they bring so much strength, to the work that we do. For example, from my experience, I would say some of the colleagues that I've worked with who are neurodivergent, they've got exceptional qualities or exceptional skills that can be harnessed positively to make sure that the work that they do with the families that they work with is actually, of good quality, really. For example, some of them, they've got a high attention to detail, which is, obviously common in autistic individuals. So who would want somebody who has got high attention to detail, really? Sometimes some of them, they can be quite creative in problem solving. This is quite common in some, colleagues who have got ADHD or dyslexia. Sometimes some of them, they've got a strong, sense of justice and ethics, and it helps you when it comes to reflection on some of the cases that you are discussing, because they would bring up, that strong sense of justice and ethics, in the conversations that you are also having. And they also have the ability to be seeing things from a different lens because of, sometimes the condition that they have, or they are able to actually sympathize or empathize with the family in a way that, you and I may not necessarily be able to do. For example, some of them, they also present with a level of, deep sympathy and, emotional intelligence, which is quite common, for them, for some of these colleagues who are neurodivergent. And sometimes there is what we call out of the box thinking, which is quite common, which is something that you also come to realize when you are managing or when you are, supporting colleagues who are neurodivergent, It actually goes to an extent of them being able to actually challenge the status quo, because sometimes they have these inhibitions that you and I may be having, and sometimes it also, offers some fresh insights into the work that we do, and sometimes the level of resilience and the level of adaptability is something that you may need to be harnessing and making sure that they actually channel it positively in the work that they are doing, really. especially for those colleagues who may have had experiences of navigating, non-inclusive environments. They will be able to actually step into that role and actually challenge the environment which is there, and actually be able to be an advocate for their families as well, if there is that non-inclusive, kind of stance being taken by other professionals who are actually supporting them. So some of the aspects of our work which may be challenging for colleagues who are neurodivergent is, I think the bottom line, like I said earlier on, is to make sure that you are cognizant of the fact that each person is different, and you need to be working with them, individualizing them in a sense, and also making sure that you have conversations with them, ongoing conversations around how things are working, reflect on how things are working, and also obviously review any adjustments which are in place, for example. So some of the aspects of our work that may be challenging would be sensory environments. For example, bright lights, loud open plan offices can be, something which can be difficult for some colleagues to cope with. How can we circumvent that situation? You can actually ask them to be able to book a room for them to be sitting somewhere where they are able to actually concentrate, and be able to progress their work, for example. And if you're able to also, agree on adjustments where they're able to work from home in a flexible manner, then you can actually agree with them, as long as you agree on targets that needs to be done, the work that needs to be progressed, and you are clear on what's being done. That's something that you can also consider. The other aspect is around the work that we do. As you know, it's time pressured, and there's need for multitasking. Some colleagues may struggle with that, so you need to be making sure that you support them appropriately, making sure that they're able to multitask, especially those who present with ADHD, and they may struggle with processing information or stuff like that. So you need to be mindful about that. The other thing would be when it comes to unclear or unstructured communication. Some colleagues may struggle with that, so they may face difficulties in interpreting vague expectations or subtle office norms and stuff like that. So things need to be extra clear for them, so that they are aware of what needs to be done. And when it comes to case allocations, when it comes to case directions, you need to be explicitly clear on what it is that you need to be seeing them doing. For example, some of them may even struggle with social dynamics and navigating team interactions, especially for autistic individuals. So you need to be making sure that you have put in place appropriate adjustments, really. And some of them may struggle with, paperwork and recording, making sure that they record their work on time. So you need to be making sure that they have got structure in place to make sure that they are able to navigate and able to progress that work, within the expected time scales, really. And frequent transitions or changes in their routines. Some, colleagues may struggle with changes in routines. So you need to be prepping them in advance, giving information in advance so that you avoid issues around anxiety and stuff like that. So that's something to be mindful about as well. So it's important to ensure that supportive dialogue is held at all levels, really, as this helps colleagues with neurodivergence, who are neurodivergent. And as a worker who might be neurodivergent, you need to be mindful that you need to be empowered. Be empowered yourself to make sure that you share how you work best, because sometimes a manager may not be able to guess or know exactly how you work best. So it's about empowering yourself, having a conversation, be open and honest about how best you can actually work. And however, you also need to be mindful about the fact that sometimes the way you think things should be working may be different from the expectations of the service or from the expectations of the organization. So it's not always the case that whatever you think needs to be happening should be what the manager should be adhering to, because at the end of the day, the manager needs to also be making sure that work is done and the expectations of the agents or of the organization are actually met and all that. So you need to be mindful about that. But as an individual, be empowered to share how you work best, and also consider using access to work for those obviously who are working in England, to make sure that if there are any assessment that needs to be done or workplace adjustment that needs to be done, they are also done accordingly. It's important for you to be having those conversations with your line manager in your personal supervision, so that these can be progressed. Because remember, there are some adjustments that can be made. For example, if you've got sensory issues, there could be noise cancelling headphones that can be provided. So, the local authority is mandated to be making sure that they put in place the best workplace for you to be able to do your job. So there is support out there. Sometimes, if you don't open your mouth and talk about it, people will not guess that this is what's needed for you exactly. Sometimes it's important for managers or for colleagues to be mindful about this, making sure that they use written or visual tools to support communication. For colleagues who are neurodivergent, for example, sensory profiles, we are talking about mind maps, and also, adjustment passports, which will enable them to be accessing the same kind of equipment if they are not working in their primary location. For example, if your local authority has got multiple locations where one can actually log in from, or of one way one can actually work from. So you need to be mindful about all these things. And for the colleagues and peers, the way you can support colleagues who are neurodivergent would be to foster an open and non-judgmental culture within your teams where differences are accepted and are actually strengthened at the end of the day. So it's, we need to be mindful about these things. The second thing that we need to be mindful of as colleagues or peers would be to respect that people may communicate or process things differently. You don't need to be always seeing things in a bad light when it comes to other colleagues, because you never know what's going on with them. You never know, what they are going through. So we need to be mindful about that. It's important for you not to assume always, or for you to assume that everybody works in the same way, because obviously we are different. And if a colleague is neurodivergent, sometimes they may not necessarily want people to know that they're neurodivergent, or they only want their manager to be aware that they're neurodivergent, but not the rest of the teams. Obviously, there will be downsides to that, but sometimes you need to respect, their preferences with regards to that. And the other thing we need to be mindful is about, in terms of avoiding assumptions, obviously, because they do sometimes degenerate or lead to issues around gossip within the teams, negative assumptions about colleagues, and, sometimes because a colleague needs flexibility, or they're not able to do things, the way you do them, or they do things differently, then you start to be, talking bad about them and stuff like that. We need to be mindful about that. It's about respect. We need to be respecting each other, knowing that we are coming from home, come to work, do what we need to be doing, and going back home, and just do what you need to be doing, and be supportive. Make sure that the environment that you're working with, if you were in the shoes of that particular individual, how would you want others to treat you? That's something that we need to be mindful about. Then moving on to the managers and supervisors, or advanced practitioners in the teams, what is it that you need to be doing? I'm going to talk about creating a safe spaces for disclosures and regular check-ins, because if you don't have regular check-ins with your staff members, they don't have an opportunity for them to be able to open up, because you haven't offered that safe space for them to be talking. You can't expect them to be talking about what's going on with them in the open space, but sometimes, make sure that you create those safe spaces for them to be able to talk about, even if it means 5-minute chat with them, even on Teams, or 10-minute chat with them, check in with them almost on a weekly basis or on a daily basis, just to see whether things are okay with them and stuff like that. So that's something that you need to be mindful about. And as a manager or a supervisor, we need to be asking open and supportive questions, in terms of how, they think they can be supported. For example, what does a good day at work look like for you? If a colleague, is neurodivergent. For example, when they are starting, review with them how things have gone on the first day, review with them how things have gone by the end of the week, so that you capture those, nuances of the things that they'll be talking to you about. And then, because that's what's going to feed into your plan of how best you can support them going forward. And some of the questions you can actually think would be, are there any parts of the job that feel harder for you to be doing, or that feels harder than they need to be? Or is there any other parts of the job that you feel you would need specific support to be able to progress, for example? Or questions like, how can I support you to do best in your work? Things like that. Be innovative in terms of how you can, support colleagues who are neurodivergent, really. And the most important thing is, when they bring such information to you, it's not about you just gathering information and not taking action. Make sure that you take action. If it's things beyond your control or beyond your scope of what you can do as a line manager or as a supervisor, then speak to your head of service or to somebody else who you think will be able to actually bring about the changes which are required. If there's need to speak to HR, involve HR. If there's a need, or if you think that there's need for a risk assessment to be done, for example, if a colleague is pregnant or their specific condition would need a proper risk assessment to be done, then one needs to be done. If there's need for a specific assessment to be done, depending on the information that they're bringing to you, then you need to be mindful of that and you need to be progressing that straight away. As a manager, think about the reasonable adjustments that you can put in place. This could include, for example, flexible working, quiet workspaces options, or noise cancelling tools, for example, noise cancelling headphones that one can wear when they are in the office so that they can be able to concentrate, cancel all the other noise, and be able to focus on what they are doing. We are talking about the written instructions, task lists, to-do lists. Encourage them to be using to-do lists, extra time for certain tasks. For example, you need to be readjusting the way you work with somebody who is neurodivergent as compared to somebody whom you think is not neurodivergent, for example. And remember, some of the colleagues who may be neurodivergent may not necessarily have a diagnosis. So it's about you picking that as well and having those conversations with them, which, for example, if you have a conversation, I know at some point about 10 years ago, I had a conversation with a colleague whom I felt was neurodivergent, but because nobody had picked it, the conversation which I had with them, which was on more than once, really enabled them to seek some assessments to be done, and those assessments were done, and we were able to actually put in place the necessary adjustments. So it's something that you need to be mindful about, to make sure that when information is brought to you, sometimes even if they may not have any diagnosis, it's about also you having conversations with them and supporting them through the process of them getting that assessment done, getting that diagnosis done, and then putting in place the necessary adjustments or arrangements in place. Because remember, some of these assessments, when they are done, they come with recommendations, and it's about adhering to those recommendations and making sure that those things are actually put in place. So it's about being mindful of that. And the most important thing is, as a manager, is you need to be modeling acceptance yourself first, because it can only filter through to the team members when you, as a manager, you're able to model acceptance, inclusive leadership in the way you lead the team, and your tone sets the team culture. At the end of the day, your tone sets the team culture. So that's something that we need to be mindful about. So what practical steps can we take to foster inclusion, as organizations or as teams? The first and foremost, I would say, is, offer neurodiversity awareness training for all staff members, and make sure that this is available almost on a quarterly basis. And if there are webinars that, staff members can attend, make sure that, they are able to attend. And, as managers or as leaders in organizations, we need to be avoiding this idea of one-size-fits-all approach, and we need to be personalizing the support that we give to these individuals. Even though you know that you've got, for example, 2 colleagues in your team who are neurodivergent, maybe both of them, they've got, ASD or ADHD, it doesn't necessarily mean that the attention or the support that they need will be the same. Because remember, for example, I spoke about autism being a spectrum. So there might be a different, slides, there might be different places on the spectrum altogether. So you need to be individualizing and personalizing that support that you are offering to the colleagues in your team. That's something to be mindful about. And then moving on, you need to be making sure that you implement a buddy system. For example, mentoring system can also be in place, but a buddy system helps in the team to make sure that that person has got somebody else who can support them at their level. Not only the support that you're offering them as a manager, but they've got somebody who can also be supportive to them at their level and be able to understand them, to understand the nuances that they bring to the team and all that. And you also need to be, as an organization, it's about reviewing the recruitment policies and making sure that supervision is being done, it's in place, and it's being done regularly according to the expectations of the organization. And the other important thing is to make sure that we celebrate neurodivergent voices and make sure that we put them on the map and we involve them, especially when it comes to decisions to do with them. So we need to be mindful that when it comes to decisions about neurodivergent colleagues, involve them. when decisions are being made about them, involve them, and encourage them to be to be part of any networks that could be there in the organization, to make sure that they're actually involved in everything that's going on. With those few nuggets, I hope I've helped somebody. If you've got any comments, please do put your comments in the comment section, and let's keep the conversation going. This information which I've given, I'm not saying it's exhaustive, it covers everything, but let's keep the conversation going so that others will be able to learn even from your comments as well. In conclusion, I'll just say, I think creating, an inclusive work environment, it's not only about, us being legally compliant, but it's about genuinely being there to support the colleagues and celebrating, that neurodivergence, which is, amongst us as individuals. And with those few nuggets, I hope somebody has benefited a thing or two. And thank you so much for watching. If you haven't subscribed, please do subscribe, hit that notification bell so that when I post, you'll be the first person to know. Thank you so much. Bye-bye.